Hello, everyone. I hope you all are safe and well. My name is Eugene Canson, Senior Policy Analyst with the Alameda Health Consortium. And as you know, there's an upcoming election. And I want to spend the next few minutes speaking on the importance of voting, as well as how our community health centers can support our communities and patients in the voting process. So today, during this presentation, we're going to reflect on the importance and impact of being a registered voter. We're going to provide examples of how community health centers can make voting visible for their communities, as well as review important dates and measures to safely vote at home. We also want to provide some helpful and some important resources for our health centers, as well as patients and communities. The importance and impact of voting. As many of you know, the right to vote is a centerpiece of our democracy. And there are several benefits both for our community members, as well as our health centers. So I want to speak to some of those benefits. Starting with the benefits of being a registered voter. So data has shown that registered voters are more active and engaged citizens, and they're more likely to connect with their neighbors, join community activities, engage with elected officials, and be an active advocate for themselves, their families, and the communities. But data also shows that registered voters have better health outcomes, higher levels of self-reported health and better health outcomes, as well as a greater sense of personal agency and power, stronger social connection to the community around them, these things which lead to greater health outcomes. So those are just some of the benefits of being an active and registered voter. But there are also benefits for community health centers. Patients who vote are more likely to be engaged as healthcare advocates, which is critical and important for health centers. And when patients and community members vote, there is a stronger voice and impact for community health centers, which really helps health centers and health center advocates push for priorities that are critical for our patients and our communities. And we understand it's important for patients to associate their health centers with civic engagement, helping to build stronger relationships with our health centers and with the communities. So now that we know that there are benefits both for being a registered voter, both for communities that we serve as well as for our health centers, what are some ways that we can strengthen the visibility of the voting process? One thing that we could do is make voting visible. Now, prior to COVID-19, many folks and many health centers created a central and visible voter engagement table or kiosk that you can put in your waiting room. But in the midst of this pandemic, there are still ways that we can make voting visible while being safe and taking the necessary precautions. For example, placing posters and other signage in waiting areas, hallways, exam rooms, having staff wear buttons or stickers letting patients know that voter registration is available in the clinic, as well as incorporating voter registration in the communications through flyers, emails, or patient mailings. These are just some examples that health centers can make voting visible to our patients and our communities, even during the midst of this pandemic. Now, I want to speak to some of the do's and don'ts of voter registration drives or voter registration efforts in general for health centers. So one thing that we do want to do is talk about elections in a nonpartisan manner, right? And so we don't want to necessarily speak to the Democrats or the Republicans, but we do want to direct people towards appropriate sources of information. And I have some examples here on this slide of websites that we can take health center patients or community members to that will provide that critical information regarding what's on the ballot measures, as well as who they're voting for. Now, some things that we don't want to do, as I mentioned a bit earlier, is we don't want to talk about the election in a way that could be seen as partisan. We don't want to tell folks who to vote for or even tell them who you are voting for. And we really don't want to endorse or oppose specific candidates. It's important that we provide the critical information that is needed to register to vote and point our community members and our patients in the right direction to learn about who's on the ballot and what they're voting for. So I want to move forward to registration and the actual voting process and what it looks like. So who's eligible to register? So if you're a United States citizen and a resident of California, you're eligible. If you're 18 years old or older on election day, 16 or 17 years old for pre-registration. If you're not currently in a state or federal prison or on parole for the conviction of a felony, you're eligible to register. And if you're not currently found mentally incompetent to vote by a court. So now I want to move on to actually filling out the voter registration card and the importance of really registering to vote. So you want to complete your voter registration information if you are a new voter, or if you are pre-registering to vote, or if you have changed your name via marriage or divorce, or if you have moved and changed your address, or if you want to change your political party or reference. I want to note that you can also register to vote online. You do not have to fill out the card. That is not the only option. You can go to registertovote.ca.gov and register to vote online as well. So how do we vote safely in the midst of this pandemic? So I do want to note that California recently passed a law that every registered voter in California will receive a vote by mail ballot for the general election. And to make sure you're registered to vote, please check your voter status or mailing address where you received your ballot visit at myvotemyhealth.org/vote. You can also track the mail ballot at where'smyballot.sos.ca.gov. I want to note that safe in-person voting will still be available, but all voters are encouraged to vote by mail to help ensure physical distancing at voting locations. So I want to provide some important dates. So here in Alameda County, voting by mail or early voting begins on October 5, 2020, and the deadline to register to vote is October 19, 2020. Also, the deadline to submit mail-in ballots is November 3rd, which is the election day. I also want to note that conditional voter registration is an option. So when elections conducted by your county elections official, you can conditionally register to vote at your county elections office after the 15-day voter registration deadline. This means that after the October 19 deadline, if you have not registered, it will be an option to conditionally register to vote at your county elections office. For more information, please go to Secretary of State's conditional voter registration page regarding conditional voter registration. So with that, I want to thank you all for listening, and I do want to encourage you all to check out Alameda Health Consortium's and Community Health Center Network's forums and our pages and our websites, which provide additional information and resources on voter registration. And I want to leave you with some helpful links and some helpful resources that may be beneficial to you and to your partners and communities as well. Thank you all, and please register to vote, and I hope you all stay safe and well during this process.